What is it that community midwives bring to a birth that makes us the safest possible way to have your baby? That's what families want to know from us. What is it that we bring that makes it so safe and so comfortable? So because all community midwives bring exactly the same equipment and exactly the same types of training, we made a video just for you so that your family will understand what it is that we're bringing that makes this the safest possible way to birth. And if you want some statistics to back that up, you can go to our website at cmidwives.com/statistics, and you can read about why 14,000 prospective births studied showed that our rates are by and far and away the best safety ratings that you can possibly have for any kind of maternity care. Here we go.
If you're having a home birth, we midwives bring everything to you. Everything you would expect to have at a birth center. Well, not the anesthesia, and we don't do surgery, but we bring everything else.
So we listen to the baby in labor and intermittently, and that's considered a safe and natural way to monitor baby's heartbeat, and it allows you to labor how you want, when you want, where you want, in different positions, and for birth to be both satisfying as well as physiological and normal. So there is no real true basis for consistent and constant monitoring in labor for a low-risk mom. The Doppler is just as effective.
One of the best tools that community midwives have to offer is hydrotherapy, and that means just spending time in water, in a tub, in a shower, or in a special birth pool just like this one that is made for laboring and giving birth in. It promotes a really good feeling of relaxation, so it can take the edge off of that intensity of really strong contractions. It can also offer a sense of buoyancy and help for switching and maintaining different positions, as well as providing time to rest. Some of our clients fall asleep in between contractions and are able to recuperate a little bit of energy. And it's also a very gentle transition for newborns. If you think about it, they are growing and spending all of their time in a warm, fluid-filled environment, and they can be born into a warm water environment and be brought straight up to your warm chest and start doing skin to skin right away. So they tend to be very calm, and it's just a beautiful transition to offer your baby. Different midwives offer different packages or different options with hydrotherapy. Some will want you to rent a tub from them. Some provide the tub rental as part of their package, and some ask you to buy a one-time use tub as part of your birth kit. So ask the midwives that you're interviewing when you're asking the questions and finding a good fit. Best of luck.
There are always 2 skilled attendants, or at least 2 skilled attendants, who will attend your community birth, such as at a home birth setting. There is at least 1 licensed or certified midwife. In some situations, there are 2 of us. In my private practice, I work with advanced student senior midwives like Alex. Alex is somebody who has not only gone through extensive academic training, but has also attended and been trained on how to assist at a birth. So if there was ever anything I needed, even if it's something as simple as setting up the birth environment, cleaning up the birth environment, or something like an obstetrical complication that would require specialized skills. So for example, a neonatal resuscitation, I know that I could count on Alex to assist me on helping a baby breathe. Or if there was an obstetrical complication like a hemorrhage or a suture job that needs to be handled, I know that Alex knows exactly what equipment to provide to me and how to assist me in the process as we take care of you and tend to you in an out-of-hospital birth setting.
Occasionally, births require us to use our skills and training to help with emergencies. And midwives are trained and prepared for life-saving moments, such as shoulder dystocia, hemorrhage, or helping babies breathe.
Many midwives are trained and certified in advanced skills such as BEST, birth emergency skills training, or also advanced life support and obstetrics. These skills practiced help us to be the best we can when emergencies do arise. That's why you want a midwife at your birth.
Community-based midwives all carry the same medications to all home births. We have Pitocin, misoprostol, tranexamic acid. We have Methergin, IV infusions, and herbal tinctures. We don't give all families these medications, and they're only given if someone is having a postpartum hemorrhage. Something that community midwives do because of continuity of care is we look at the whole picture for families and what their complete blood count was looking at the 36-week home visit, as well as how the implications of a postpartum hemorrhage can affect their breastfeeding journey.
We also have IV fluids and IV equipment available if you get dehydrated during your labor, or if you have a little bit too much bleeding postpartum. We can help you with IV fluids, and we are lickety-split quick at getting that stuff taken care of, even though we don't do it very often. Many of the people who birth with us don't ever get an IV, but we have the equipment in case you need it. And then we also do have IV antibiotics available if you have GBS and you decide that you would like antibiotics for that.
So when people ask me about the difference between a birth center birth and a home birth, I tell them oftentimes that we just basically pack up most of what we use in the birth center and we bring it to you. So what does that mean? That means that we bring things like these to help a baby breathe if a baby is having trouble. One of the things we bring is oxygen that we connect to this device called a CPAP that helps to keep baby's lungs inflated while we go to the hospital if that becomes necessary. This helps to go down baby's throat, and it helps to get the air into the lungs directly. This we've all seen probably on a bigger scale, but this is made specifically for babies. This is a tiny little baby Yambu bag. This is a pulse oximeter, and the pulse oximeter will show us the level of oxygen in baby's blood. All of this equipment is being used at the same time that a baby is connected to their placenta. Therefore, the placenta, while still working, is going to continue to give baby oxygenated blood while we do our best work to try and help baby breathe.
Hi, midwives also suture at births, only when needed. Typically, a woman will deliver over an intact perineum. They'll use the support of the water in a birth tub, their hands or the midwife's hands, and the baby just oozes out and everything is fine. Every now and then, a little something happens and there's a tear. So midwives suture. We bring everything to the birth every time. So we have suture equipment sterile, gloves sterile, various sizes of sutures. We have pain relief, lidocaine, topical injectable, spray. We have light so we can see. We have extra things, herbs and extra tools in case we need it. And we just do it real quick and get you back to your baby and a good sleep. And that's all there is to it. We'll take care of you the way you want to be taken care of. Thanks.
One of the things that midwifery brings to birthing families and is built over the period of, it's built over time in our prenatal visits, is the ability to trust each other. We really get to know each other. Families really get to know us and really get to know them. And so they really get to know us and trust that we are giving them all the correct information and all their options. And we really know and trust them that they're making the best decision out of informed consent, out of education and knowledge. This is also translated and brought into the birth, because when we walk into a birth, the parents know that we're giving them all their options and that they are the ones making the decision because it is their baby, it is their way. And this builds this respect and trust and makes labor a lot easier. Another thing that midwives bring to a birth is our gentle hands, our kindness and love, the ability to read a room and know what the birthing person or the family needs emotionally or mentally and be able to facilitate that. We bring a lot of love and compassion and empowerment, and that also makes it unique.
Midwives brings lots of things to the birth to measure and weigh the baby.
After your home birth, we weigh and measure the baby right at your bedside.
There
you go.
I love it.
Good job. You're strong.
What kind of flex do the ears have? Yep.
They're firm when they spring back.
Perfect. And then check his clavicles.
I know, I'm so sorry. I'm so sorry, you're hungry, guy. Good. That's okay.
I said 8'4", but
He is, can you see it?
the midwife also weighed the baby, and my baby weighs 8 pounds, 10 ounces.
No, he doesn't.
Yes, he does.
Is that your biggest baby?
Yeah. And just pinch it and then put it in the pinched part. Quickly, quickly, keep all the way down. All the way in. There you go.
Sorry, buddy.
He ain't even tripping.
I don't even care.
You don't have to.
Yeah.
Okay, there you go. Okay, and let go of the pinch.
So we have stripped the bed, the laundry is in the washing machine, the tub is draining right now, we're watering the garden. Instruments are soaking and being cleaned, and mom is being fed, the dishes have been done. What else is being done?
Just everything's being cleaned up and swept away. So a lot of people think that home birth can be messy, and it can. But the team here, your birth team, will get everything cleaned up and whisked away, and you'll be snuggling your baby in your bed nice and warm. After you've had your baby at home, we take care of the laundry and all the trash. I am just about to hit start on a load after a mother has had her baby. She's snuggled up in bed, and now I'll take this out.
That was really tough. High five. all 4 hours worth of work. All right.
See if I'll fit.